It's really hard to find a therapist, and one question I get a lot is what does it mean to have structured therapy versus unstructured therapy? So, traditionally, and you may be familiar with this kind of paradigm from watching TV, you see therapists sitting there passively listening and occasionally saying something astute. This is sort of an old model of therapy. CBT is an example of a more structured approach, and CBT is the most widely researched approach to therapy and has the most evidence for being effective with clients. More and more, I hear people on the phone I talk to who are like, I just want this to work, or I want my therapist to give me information. I want to move. I want to get something done in therapy. And I think that a directed, structured approach can be really helpful. What that means is that at the outset of treatment, we might work together to figure out what your needs are and what kind of modules or kind of learning experiences and practice exercises you might want to go through in your therapy process that would be really helpful and actually life-changing over the long run. So over the long run, meaning you don't have to be in therapy over the long run, but the changes that you make when you're working with your therapist for 2 to 4 months, something along those lines, really stick. Because I think that is kind of a profound idea that you could work with someone for maybe 16 sessions and have what you're doing actually gel within who you are, your psyche, your behavioral repertoire that you enact for the rest of your life. So what that means is that we would kind of create a plan together, and then in between sessions, we're going to say, hey, this is looking hard for you. Let's take some baby steps to make this feel doable. And so we would work together on whatever that is. It could be any number of things, and we could work together so that at the next session, I'm actually going to remember, as a therapist who likes structure, I'm actually going to remember what we agreed on last week and say, so how did it go? Tell me what happened. And you're going to be able to say, I didn't do it. Let's problem solve, so that I can figure out this goal in a new way. Or, hey, I did it, and this is how it worked, and this is how I could see it working going forward. One example of that might be public speaking. Maybe you're terrified of public speaking and you've been avoiding any kind of public speaking. And so maybe the starting point that we might agree on after a few weeks kind of understanding the issue is that you would agree to make unsolicited comments on Zoom calls over the next week with your coworkers to see how it goes. That's an example of a baby step that would be in line with the goal of getting more comfortable with speaking publicly. So there are endless examples on this. Please leave a comment if you have a specific question about how structured therapy works. It's one of my favorite topics.